Good evening, everyone. A warm welcome to this neurotherapy session on juvenile diabetes. So today Ramchandran sir is going to cover the syllabus of juvenile diabetes, which is there from childbirth, child gets it from childbirth, and it continues for a long period of time if it is not taken care of well. So, and neurotherapy, we all know that Dr. Lashpat Rai has brought this neurotherapy for all of us so that we can use it for all kinds of treatments and to clear the problem, whatever the problem we have, to clear it from the root cause. So even juvenile diabetes can be cleared from the root cause when we continuously follow this particular procedures, treatments, health tips, food, lifestyle, everything has to be covered when treatment is going on. So please make sure that when the treatment is continuing, you take care about the other parameters of a health, of a child's health, or to whomever it is given, either to a child, adult. When the diabetes is taken care of, we have to take care of all the parameters of the particular person so that the treatment works out very well and faster for the person whom we are treating. Okay. And neurotherapy deals with mostly only and mostly all issues are covered in the treatment, and it is done through non-medical ways which help us heal our our body has its own healing capacities, and neurotherapy provides it more essence into this particular thing, so that we can heal more faster with the treatments. So now, without wasting time, with all of us and our warm hearts, let us welcome Ramachandran sir to this session. A warm welcome to you and good evening, Ramachandran sir. Please take over. Thank you so much for this session from Joshys Group and all members. Good evening, sir.
Good evening. Warm word of gratitude to all those who have joined today. Today we'll be clearing several myths also about juvenile diabetes. Many people who know about ordinary diabetes may not know the difficulties which juvenile diabetics face. And I thought this is a very good forum to educate, inform people whether they are having diabetics in their house or whether otherwise. It will be nice that they should understand what are the great difficulties which a normal person with diabetes, a normal diabetes mellitus, DM2, it's called. So they don't face this problem, so many problems as the juvenile diabetics face. And many people may not be aware of this. So that is why I have taken this topic. It is a pretty long topic because I am covering it rather extensively, because I always feel that knowledge given only a little bit is no knowledge at all. A little bit, if I have to give, that you can already read it. It is all available in the internet. But that's not my intention, because the internet will not say so many things which I wish to say. So I have tried to amass a lot of information, and I'm sure you will all love it, because my classes are always, that's what many people told me, that they are quite interesting. So a very grateful thanks to Joshys Kerala Group, Joshi sir, Anusha madam, and the team members. And now, without much ado, I will now start on this. I'll be showing a PPT which will be giving you the salient points. But more than that, There is hardly anything much in the PPT. I would like you to listen carefully to me, and wherever you need it, wherever you need, please do take notes, because some of these things are really, I even was not aware of the fact that so many uh, difficulties where we would have been faced by the diabetics, the juvenile diabetics themselves. So let's start. So here goes. Now on, you can see now Dr. Lajpat Rai Mehra, the founder pioneer of this unique medicineless therapy known as Lajpat Rai Mehra Neurotherapy. Okay, thank you. And now, good evening, everyone. I am truly honored to be here with all of you today. We have gathered for an important conversation. I call it a conversation because definitely anybody who has any doubts would be welcome to write his doubts. First, you write it with yourself, and later on, we will have a question answer session around 9:30 or so. That means I'll be having about 1.5 hours of the theory, which will explain in great detail. And then we'll have question answer session where I will clear all your doubts to the best of my capability. So this discussion is one that touches the lives of hundreds and thousands of families across India and the whole world. And it is called juvenile diabetes or type 1 diabetes mellitus. So I first start by asking, how many of you know a lot about type 1 diabetes before today? Probably the number of hands would be very few. And if you can raise your digital hand, if you really know a lot, I would like to see if many people know a lot about, yeah, Selvarani ji knows a lot about it. Very good. Then Dr. Geeta Ramakrishnan, yes, of course. Fedwa. So about 3 people have now raised their hands, which means the rest of the 44 or 45 people have to be told properly about it. And so I also again ask, now these 3 people can lower their hands. How many of you personally know a child or teenager who is living with this condition? That means you yourself need not name yourself. But if you know, how many people do you know a child or teenager who is living with this condition? So there probably, Dr. Geeta Ramakrishnan and Fedwa and the sister Mercy Angelina. So 3 people. So which means still a lot of people do not know. A lot of people. Thank you, madam. All of you, you can lower your hands. Thanks a lot. So this was just for me to understand how many people are there who need a lot of education. That means the whole group needs a lot of education. Even you who know all these people, you may not, for you also, many things may be new. So first of all, juvenile diabetes is often misunderstood because many still confuse it with type 2 diabetes because that is more commonly discussed in the media. But juvenile diabetes is very different. It is not something one grows out of. That's the point. DM2, I refer to diabetes mellitus as DM2. That is diabetes mellitus type 2. DM2 can be outgrown in the sense with proper lifestyle, with proper exercise and little bit of treatment where necessary, one can have a nice life without diabetes also. After about a couple of years, you can be free from diabetes, provided you have DET, that is diet, exercise, and treatment. But juvenile diabetes is what is known as an autoimmune condition. That means it occurs when the body's immune system attacks its own insulin-producing cells in the pancreas. We will be talking in great detail about these things in the later on. But unfortunately, as of today, there is no known cure in the realm of medicines. And of course, in neurotherapy, you will see we'll be harping on this topic that by neurotherapy, there will be a lot of change in the quality of life of both the patient and their caregivers, parents or otherwise. So, for example, let me give you an example. There is a boy from Raipur. His name is Arush, just a 7-year-old boy. And his parents were shocked when after several weeks of he had constant thirst, frequent urination and fatigue, and then he was diagnosed with type 1 diabetes. A 7-year-old boy was diagnosed with type 1 diabetes. But up till then, he had always been very active, very healthy, and full of life. But his diagnosis came as a total surprise. And yet, Arush is just among the thousands of children in India who are living in this condition. So, India is seeing an increase in the number of children diagnosed with type 1 diabetes. It may surprise you to know that juvenile diabetes is more common than many think. In fact, India ranks among the top 10 countries in the world in terms of the number of children living with type 1 diabetes. These numbers are increasing steadily every year. And more importantly, many cases, they go undiagnosed or they are diagnosed late, which can lead to dangerous complications like diabetic ketoacidosis. You will be now surprised to know that over 1.5 million children around the world are living with this condition. According to the International Diabetes Federation, we have over 100,000 children diagnosed with this condition, and that number is steadily rising. Okay. Yet awareness remains low and myths persist. In India, we are seeing a rise in type 1 diabetes cases, especially and unfortunately in urban centers like Delhi, Mumbai, and Bangalore. Yeah, because in the rural villages, because they are following a much better lifestyle, a more natural lifestyle, type 1 diabetes is not so much known there, but it is very much common in Delhi, Bombay, Bangalore, and other places also, Calcutta, everywhere. For example, at AIIMS, Delhi, All India Institute of Medical Sciences, Delhi, the pediatric endocrinology department sees hundreds of new cases every year. So now this session, I wish to change all that. That is the aim. The purpose of today's talk is to give you a clear understanding of what juvenile diabetes is, how it differs from type 2, and it is an autoimmune condition, as I said, where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. This is very different from type 2 diabetes, which is more commonly linked to diet, obesity, and lifestyle, and usually occurs in adults. Then we will talk about the biological and medical understanding of the disease. Then the signs and symptoms every parent and teacher should know. So I wish to take this opportunity to inform all of you that if you know anybody who is having a child who may be having this problem, or any adult, you can tell them to attend this session. After all, Joshys Kerala groups sessions are all free educational sessions. So if you have the time and the inclination, please ring up your friends, please ring them up, please ring up your acquaintances and tell them to attend this session. We have just started. There is a lot of this thing groundwork to be covered. So they would not have missed anything if they join now. Then the signs and symptoms every parent and teacher should know. This is also every parent, teacher, and nowadays every adult should know how it affects children and families. The practical everyday aspects of living with type 1 diabetes, including physical and emotional impact. Now you will see this physical and emotional impact, so many new informations I have now gathered, and social challenges faced by children and their families. And then we will also tell you how it is to be managed daily, basically from the allopathic point of view, the management strategies, including insulin, diet, and lifestyle. So, and there are a little bit more advances in medical technology and future directions, and how we can offer support and create a more inclusive environment for these children that can make a world of difference. So this is all which we will be covering in either in this class or in the next class also, because there is a lot of matter to be covered. I may not be able to cover everything in one class. Then this class will spill over, so people can easily understand, because I want to go slow. As you have always seen me, I want to be giving the maximum knowledge for everybody, and having this theoretical knowledge will be very useful to each and every person, because in case you ever meet another person who is having a child or a teenager who is diagnosed with type 1 diabetes, then you can tell them to contact me or to contact Anusha madam. They can come all. I will be soon announcing the diabetes challenge class again for the next batch of people. So already some people have been inquiring after the diabetes challenge class. So I will be soon announcing it. And I want everybody to be well informed. In those classes, we will be giving the actual treatments also. And as you perhaps might have already been aware, the previous diabetics challenge class was very successful. We had almost 50 people who had benefited in many ways. They were quite happy with this thing. Of course, the total strength was 75, but a few numbers were just people who were joining only for knowing about the knowledge, and many others who were actual patients had joined, and they got a lot of benefit. So now let us understand the disease. Let us begin by understanding exactly what happens in the body. So insulin is a hormone which is produced by the specialized cells in the pancreas. These are called beta cells. There are special cells called islets of Langerhans, and in that islets there are alpha cells, beta cells, and delta cells, and another PP cells. So out of this, the beta cells are the ones in this islets. They are the ones which are manufacturing insulin. So this insulin, what is its function? It acts as a gatekeeper, helping sugar or glucose from the food we eat to move into the body cells, where it is used for energy. Without insulin, sugar stays in the bloodstream, glucose builds up in the blood and causing high blood sugar levels, which is also known as hyperglycemia. In children with type 1 diabetes, the immune system, due to genetic and environmental factors, mistakes the beta cells for harmful invaders and starts destroy them. So the immune system is supposed to protect us, and in most people it is protecting. But in the case of an autoimmune disorder, not only in juvenile diabetics, there are many disorders which are known as autoimmune disorder. A very famous one is called Hashimoto's thyroiditis, and there are many others, Graves' disease, so many. Okay, so in that, what happens? The immune system, which is supposed to fight only the invaders, it is supposed to fight all foreign pathogens. It does that job, of course, but in addition, by mistake, it starts harming or killing our own cells. Depending on where it launches its destructive action, the name of the disease is given. That means in Hashimoto's thyroiditis, the name is given because it attacks the thyroid gland. In juvenile diabetics, it attacks the beta cells of the pancreas. In Graves' disease, it also attacks the thyroid gland, and also it can attack the eyes, etc. It's called exophthalmos. So like that. So many. In myasthenia gravis, it attacks again the eyes, and it attacks what are known as acetylcholine producing producing cells. So like that, it attacks various places. In osteoarthritis of the knee, in some people, it attacks the knee joint. Like that, so many places it can attack. And wherever the place it attacks, it is given a name. The disease is carrying a different name. Now, in neurotherapy, what we do is we try to find out, locate the root cause of this problem. And then we try to teach the body to heal this case. That is how we do it in neurotherapy. We are quite reasonably successful in helping patients of autoimmune disorders also. But now let us come back to insulin. So this autoimmune attack usually happens over a few weeks to months. And it is like the body's defense mechanism goes rogue. And it becomes like a rogue elephant, you know. The rogue elephant starts attacking its mahout, starts attacking everybody in the way, etc. like that. So the destruction of the beta cells means the body can no longer produce insulin. That is a problem. So insulin is a hormone which is essential for life. Okay, in my next class, I will tell you what are the various ways. We only know about insulin and the pancreas. There are various ways in which insulin helps the body, not only the pancreas. Okay, so now once these beta cells are destroyed, insulin production completely stops within a short period, and then the child becomes insulin dependent for life. So as said earlier, without insulin, glucose builds up in the bloodstream, leading to what is known as hyperglycemia, that is high blood sugar levels. So let me now share a story of Rahul, one of our patients, a 10-year-old boy from Nashik. Rahul was a bright student, but started becoming lethargic. Now, very nice, studious fellow, but he started becoming lethargic, and he was constantly thirsty, and he had to use the toilet frequently. So initially, of course, his parents thought that it was due to the summer heat. You know, Nashik is very hot in summer. So, but one day he fainted in school, and he was rushed to the hospital, and there it was noticed that his blood sugar level was 480 mg per dl. What should be in the range of 110 to 140 became 480, and that is when he was diagnosed with type 1 diabetes. So this is why children with juvenile diabetes need to take insulin externally for the rest of their lives, because their pancreas is not manufacturing insulin. But why does this happen? Well, the exact cause is not known. That is the pity. The exact cause is not known, but researchers believe it is a combination of genetics and environmental triggers. One of the trigger is viral infection. If a child has certain genetic markers, a viral infection might set off the autoimmune attack. That means the genetic marker, if it is present, then even a small viral infection can set off the autoimmune attack. Then we have other examples also. I'll be giving examples where the symptoms from which you can understand what are the symptoms which a patient normally feels, and how to, once you know these symptoms, we say forewarned is forearmed. So like that. So Priyankshi, a 10-year-old from Nagpur, She was diagnosed shortly after recovering from a severe viral fever. Her parents noticed a drastic change in her behavior. She became tired, became irritable, and lost weight. After several tests, she was diagnosed with type 1 diabetes. Then Nikhil from Kochi in Kerala, he had no family history of diabetes, but yet he was diagnosed at age 12. So this highlights that while genetics can play a role, they are not the only factor. That means genetics can play a role, but there are cases where genetics has no role. That means what else would be the reason? The improper lifestyle of the child, eating unwanted things, etc. So the immune attack often begins months before symptoms appear. By the time the diagnosis occurs, most of the insulin-producing beta cells are already destroyed. This is why awareness and early detection are so crucial. For example, a 9-year-old boy in Pune was diagnosed after his parents noticed he was constantly thirsty and losing weight. So these are all some of the things, some of the common symptoms, and I will be discussing the cause for these symptoms also. Similarly, a 6-year-old in Lucknow had repeated urination at night and was found to have very high blood sugar levels. Hence, it is crucial to spread awareness about these symptoms because early detection can prevent emergency situations. Now, what are the symptoms to watch for? I am only listing some of the most important symptoms. There are many more also, but we have restricted the limit to about the list to about 8 or 10 or so. Number 1 is frequent urination. And naturally, when there is frequent urination, there will be excessive thirst because as the body is giving out water through urine, then naturally the person will feel thirsty. But there is also sudden unexplained weight loss. And in children, bedwetting who are previously dry, this is a common factor in children. Okay, increased hunger but continued weight loss. Then extreme fatigue or drowsiness, irritability or mood swings, and then blurred vision. And in very severe cases, you have nausea and vomiting, leading to a condition called diabetic ketoacidosis. And what is the symptom of diabetic ketoacidosis? A sweet smelling breath. Sweet, fruity flavor breath will be there. And it is in some adults also, in type 2 diabetes also, sometimes they can have this ketoacidosis, sweet breath. But it is very common in type 1 diabetes. Now, children often come to the hospital in a state of diabetic ketoacidosis, that is called DKA, and this is a serious and potentially fatal condition. Simply because the signs were missed, they come to this stage. So in Bhubaneswar, a 9-year-old named Meera was rushed to the emergency room with vomiting and shallow breathing. So vomiting and shallow breathing, as I said, is a sign of diabetic ketoacidosis. And what were her sugar levels? Not 200, 300, 400. It was 600. And she was in DKA. And she had to undergo 1 week in ICU. And then she was stabilized. And then she was started on insulin. Today, with proper management, she is thriving. So now, let us see detailed causes and some examples also for each symptom. Why these symptoms happen? Number 1, frequent urination. That is called polyuria. What is the cause? When blood glucose levels are very high, the kidneys attempt to remove the excess blood sugar from the blood by filtering it and removing it in the urine. Now, when it is filtered, when the excess sugar is removed, glucose pulls more water into the urine. This is called osmotic effect. So the glucose, when it is going out through urine, it also pulls water. And then this leads to increased urine production, and that is why the child has frequent urination. Okay. Then example, we have got 12-year-old Karthik from Ahmedabad. He started waking up multiple times at night to use the bathroom. His parents initially thought it was a urinary tract infection. So sometimes urinary tract infection, then they will, what they will say, they will tell the child, drink a lot of water. They may give coconut water, etc., because coconut water is good for urinary tract infections. But then when they went for the test, the doctor said, you test your blood sugar, and then blood sugar was over 300 mg. Okay. And then a pediatric endocrinologist was consulted, and then he was diagnosed with type 1 diabetes. So this was the first, frequent urination. Now, what is the cause for the next symptom? Increased thirst. That is called polydipsia. So polydipsia, frequent urination, is called polyuria, and then this is called polydipsia. So frequent urination leads to dehydration, which in turn triggers excessive thirst. At the time, the brain signals the body to drink more fluids to compensate for the water lost in urine. So example, a 9-year-old girl called Ayesha from Bhopal, she started asking for water every 15-20 minutes, even at night. Her school teacher noticed she was constantly sipping from her bottle during class. Actually, these juvenile diabetes, they cannot drink a lot of water. They will require to drink small sips of water, small sips like that. So the school teacher noticed she was constantly sipping. And then this unusual behavior, they prompted her parents to get her checked, and it was a diagnosis of juvenile diabetes. Then the third is sudden weight loss. This is the third symptom. What is the cause? Despite eating well, the body is unable to use glucose for energy. Why? Because of lack of insulin. I told you, juvenile diabetics, they have lack of insulin. Their body cannot produce insulin at all, or very, very small quantities. So then what happens? The body starts breaking down fat and muscle for energy. So when muscle and fat is broken up for energy, what happens? There will be a weight loss. So that is why rapid weight loss is there. So we have a boy, 14-year-old from Ramesh in Chennai. He lost 5 kg over 2 months, even though his appetite increased. So he went on eating properly, but then he lost 5 kg. So then parents thought first it was due to exam stress. You know, before exams, children often have this problem. So that misunderstanding may be there. But then when they took blood tests, it showed high glucose and ketones. Then he was immediately hospitalized and diagnosed with type 1 diabetes. Then the fourth cause is extreme fatigue or drowsiness. The fourth symptom, extreme fatigue or drowsiness. Okay. Now, without glucose entering the cells, the body is deprived of its main energy source. As I told you, glucose is the source of energy for all bodily activities for all of us. We thrive on glucose. And in fact, the brain is requiring almost 20% glucose. That is why the brain is the one organ which does not require insulin for its glucose. It can directly absorb glucose from the blood without the need for insulin. And that is how diabetic type 2, they don't have much problem because the brain is having insulin enough. But without glucose entering the cells, its body is deprived of its main energy source. Additionally, because of dehydration, these people cannot drink too much water at a time also. So there is dehydration, and breakdown of muscle contributes to weakness and lethargy. We had a boy, Nikitesh, an 11-year-old from Patna. He used to come home from school and fall asleep for 3 to 4 hours. His grades dropped and he stopped going out to play. His doctor suspected anemia because many children have anemia, no? So thought, and anemia means there is not enough blood cells to carry the oxygen around. So they will feel lethargic, they will fall asleep, etc. These are common symptoms of anemia. So first the doctor suspected only anemia, but then further testing revealed high blood sugar. That means with high blood sugar, the person will fall asleep, or he or she will feel fatigued. And she had an autoimmune profile also, which confirmed type 1 diabetes. So now the fifth symptom, irritability or mood changes. This again is very alarming to some children, some parents. First, they don't understand why their child is so irritable or having sudden mood changes, crying now and then. Unfortunately, people cannot understand. The child itself is not able to understand. And all that was because of fluctuation in the blood sugar level, especially hyperglycemia or hypoglycemia. That means more sugar in the blood or less sugar in the blood, both. That can affect the brain function. So, as I told you, the brain requires 20% sugar. But if the sugar is not available in the blood also, and it's not able to enter, then there is a lot of difficulty. So, because of the fluctuation, sudden fluctuation will be there. Early morning, the blood sugar may go down suddenly, or late in the evening, it may go down, etc. So that can affect brain function, and that is what leads to mood swings, irritability, and even depression in older children. And lack of restful sleep due to nighttime urination and thirst can worsen the emotional state. So for all these things, we have got good treatments in neurotherapy. So we have an example, 13-year-old Samira from Delhi. She became increasingly argumentative and withdrawn. Now 13-year, the teenage is an age where children, even as it is, they become a bit argumentative, they become questioning, a little bit of disobedience. This all of you know. That's all these things happen. But then the teachers noted she was unusually quiet and unmotivated. At home, she was argumentative, and in school, she was unmotivated. So then she was diagnosed with type 1 diabetes, and she was started on insulin therapy. Then immediately her behavior improved within few weeks. Then the other symptoms is very important symptom is blurred vision. High blood glucose causes the lens of the eye to swell. Yeah, so why this blurred vision is happening? Because the lens of the eye starts swelling, and then its shape temporarily changes, and thereby the eye's ability to focus is impaired, and this leads to blurred or double vision. So we had Deepak, a 10-year-old in Pune. He complained of not being able to see the blackboard clearly. So he used to come home and tell his parents that I am not able to see the blackboard clearly. To go and ask the teacher to put me in first bench. Now, sometimes the teachers will respond, sometimes they will not respond, and all that. But then he went to his optician, and the optician found no change in the spectacle number. So why then this happened? Then that raised a red flag. Then his pediatrician ran a blood test and found a fasting sugar of 285 mg per dl. So that was all. That is this thing, that high blood sugar had caused blurred vision, because high blood glucose causes the lens of the eye to swell. Okay, then another very common this thing which I spoke earlier also, that is called nausea and vomiting. This is a typical symptom of diabetic ketoacidosis. So when the body can't use glucose, what happens? It starts breaking down fats for energy, and in the process, a special chemical is produced that is called ketone, and that is the ketone is the one which is responsible for the sweet smelling breath. Okay, so high level of ketones, it is accompanied by an acid which is called ketoacetic acid. So that acid, when it high level of ketones and ketoacetic acid is there, that can become a life-threatening condition, and that is called DKA, diabetic ketoacidosis, DKA. And some of the symptoms are nausea, vomiting, stomach pain, rapid breathing, and confusion. So Tanmay, a 7-year-old from Ranchi, he was admitted to the ICU with vomiting, rapid breathing, and confusion. Initial tests showed a blood sugar of 520 mg per dl. A 7-year-old boy having blood sugar of 520 mg per dl, and then high ketone levels. Then he was treated for DKA and he was diagnosed with type 1 diabetes. But by proper treatment, his condition was stabilized within 48 hours of insulin and fluid therapy. So now, how do you diagnose? What are the parameters for diagnosing? Very simple. A fasting blood sugar more than 126 mg per dl. This is the diagnostic parameter. Fasting blood sugar, that is called FBS, of 126 mg per dl or more. That is the criteria for juvenile diabetics. Then HbA1c, we all know HbA1c, that should, if it is more than 6.5%, then it is juvenile diabetes. Then there are tests called auto-antibody test. There are tests called GAD65, ICA, etc. No, they are also tests which are done to confirm. And then there is a C-peptide test, which checks the residual insulin production. So all these tests are how the diagnosis is confirmed. And the advice which doctors give, and which is the very correct, is that sooner the diagnosis, the better the outcome. Delayed diagnosis not only increases complications, but also makes the adjustment period more traumatic for the child and family. Okay, so now we come to the living with type 1 diabetes. What are the, I told you now, these certain very different from type 2 diabetes. Type 1 diabetics has got many social and emotional problems. So these are all some things which are quite new even to me, but I have found that we can give substantial benefit. As I said, the previous diabetic challenge class, we had a few juvenile diabetics themselves, and they had all, their quality of life had improved. Okay, so let us see how children live with this condition. Now, managing type 1 diabetes is a full-time job, both for the child and the family. Unlike adults who can manage diabetes with lifestyle changes or oral tablets, children with type 1 diabetes have to take insulin externally, either through injections or via a pump. There is a special pump also for it. So what are the challenges which are faced? The challenges are, this is something which you may not know, managing the condition during school hours. That is a big challenge. I will tell you why. There are many aspects to it. Then fear of insulin injections. You know, every time the child has to be poked, so naturally that it generates a fear. Okay. Then peer pressure and social stigma. So imagine being a 10-year-old and having to take 4 insulin injections every day. Imagine having to prick your finger multiple times just to check your sugar level. I mean, to check sugar level itself, you have to prick multiple times, isn't it? And imagine not being able to eat birthday cake without doing the math. What is it? You have to count the carbs. All these things, the children become adept nowadays. Those who are juvenile diabetics, if they are properly trained, they have to count the carbs, they have to adjust the insulin, they have to check the blood sugar. This is the reality for children living with juvenile diabetes. So daily management includes what? Number 1, insulin administration. Number 2, blood glucose monitoring. And number 3, dietary planning. And number 4, exercise and sports. Now we'll see all these one by one. So insulin administration, either children use what is known as MDI, multiple daily injections, or insulin pump. And nowadays, insulin pumps are more becoming common. The injections include long-lasting and short-acting insulin. So long-lasting insulin is called basal insulin, and short-acting insulin is called bolus insulin. Now, Kavya, a 14-year-old from Delhi, she takes 4 insulin shots a day. Her parents maintain a log book of each injection, meal, and activity. Her school nurse has been trained to help in emergencies. So all these things the parents have to undergo. They have to maintain a log book. They have to maintain the activity. What are the activities the child is doing? Some days the insulin dose will have to be more. Some days it has to be less, etc. And of course, you have to take the help of the school nurse also. So then the next one is blood glucose monitoring, BGM. Actually, BGM, for me, I was a student of Film Institute. So we call BGM as background music. But here, BGM is also a different type of background music. It is blood glucose monitoring. Children need to check their sugar levels at least 4 to 6 times a day, sometimes more. 4 to 6 times a day, they have to check. And every check means pricking. And then they use glucometers or continuous glucose monitoring devices. Okay. This glucose meter is called, the continuous glucose monitor is called CGM. They give real-time sugar levels and they reduce the need for frequent pricking. So this CGM is a good alternative to frequent pricking. So Ishan in Bengaluru uses the CGM with alerts that are sent to his mother's mobile phone. And this system has helped to avoid nighttime hypoglycemia. This nighttime hypoglycemia is a very scary thing, because if you have too much hypoglycemia, you will go into coma, anybody. And that is all because suddenly the body, this thing, insulin level, more, this thing is used up, glucose is used up from the blood and all that. So they have to very carefully, they have to monitor it. And in Ahmedabad, a 12-year-old boy uses an insulin pump. Okay, but somebody uses a CGM, somebody uses an insulin pump. But then, and this Ahmedabad, this thing, boy's parents, they invested in it after realizing that multiple daily injections were emotionally distressing for him. The pump gives him better control and flexibility and uses a CGM to track his sugar levels. So that also pump also uses CGM. And now that boy plays cricket regularly, but his parents adjust his insulin dose on match days to prevent hypoglycemia. So on match days, the insulin dose is reduced so that the child should not have hypoglycemia. Harini from Chennai stopped taking her insulin at school because she felt embarrassed. This is the school problem. Then after a teacher was sensitized to her condition, a private space was arranged. And now she manages her diabetes openly. So this was something which the school cooperated. The school management cooperated. The teacher was very cooperative. And that is how that girl was, this thing, was free from her embarrassment. But you can understand, boys at least, they will not be having so much problem, except that they will have peer pressure, people mocking at them. Some children mock at them. But girls, what a mental harassment it is. We just cannot imagine. Okay. Then the third one is dietary planning. So we talked about this thing, CGM and other things, monitoring, etc. Now the third thing is dietary planning. Children need a balanced diet that is low in refined sugar. In fact, they should avoid refined sugar totally. They can, in fact, take things like honey a little bit, but refined sugar should be avoided. and they should have a diet which is rich in fiber and protein, and they must learn carbohydrate counting so that they can calculate the insulin doses. So Kavya, a 12-year-old girl, what she does, she carries a meal chart to school. Her lunch includes chapati, a boiled egg, curd, and a small portion of fruit. And she avoids deep fried snacks and sugary drinks. So these are some of the in diet. This is a very simple diet. In fact, instead of chapati, nowadays the doctors are recommending millets. They are saying you have millets, you have a roti of millets rather than wheat chapati. And then a boiled egg is always good because calcium, it supplies the calcium which is needed for the body, and curd also supplies calcium. And then a small portion of fruit which does not have much sugar, any fruit like that, like chiku, sapota, we call it chiku. Chiku is a fruit which is good for diabetes. Pepe is a good fruit which is good for diabetes, etc. And she avoids deep fried snacks and sugary drinks. This is very, very essential. Children should learn to avoid totally, even all children, they should avoid deep fried snacks and sugary drinks, because there is no point in unnecessarily, we don't know when the diabetes can strike. So all children should be taught to avoid deep fried snacks and sugary drinks. And of course, then she should exercise, and sports is very essential. Regular physical activity is encouraged, but whenever there is physical activity, insulin and food intake must be adjusted accordingly. This the doctor or the dietitian normally will be helpful. So we have Arjun, a football player from Pune. He checks his sugar before and after practice. And this is recommended for such cases where you are having strenuous exercises, etc. Or if children are going to the gym, then it will be nice if they check the sugar before and after practice. And at the same time, always keep glucose tablet handy during matches, because anytime if he feels a little bit giddiness or dizziness, then he can immediately pop a glucose tablet into the mouth. Then what are the school related issues? Number one, inability to store insulin. Then fear of hypoglycemia during class. And then lack of trained staff. Because you see, all schools will not have trained nurses. So lack of trained staff becomes a big problem. And then fear of hypoglycemia during the class. So that is also a problem. So these are the school related issues. And solution examples are, in Ahmedabad, one school created a health room that is equipped with a fridge, a glucometer, and a trained attendant. This initiative was started by a parent group, and it has now been adopted by 4 other schools. Then emotional impact. Feeling different from peers. That is the first thing. You are different because you always have to have your glucose monitoring and all that. Then peer teasing or bullying. Of course, there are techniques to avoid this also. Then anxiety about insulin injections. So in a workshop in Hyderabad, a teenager shared that he hated lunch breaks because he had to check sugar while friends teased him. But then what they did, they conducted awareness sessions in the class for the other students. And the great thing is, once the other students came to know all these difficulties which this child was facing, they felt remorseful, and the teasing stopped, and at the same time the classmates began reminding him to check his sugar level. Without making fun, the classmates became a positive support to the child. So this is because of course this the parent teacher association and so many things had a role. Now let us see what are the parental role. Parents are the frontline caregivers. That is number one. So they should educate the child without instilling fear. They should not instill fear in the child. Oh, if you don't take tablet, this will happen, that will happen. If you do exercise, tum behosh ho jaoge. I mean, you will faint and all that. All those things should not be done, because they are the frontline caregivers. So they have to educate the child, but without instilling fear. And then they should gradually teach self-management. So let us see some examples. In Jaipur, a family, what they did, they created a daily chart with the child, and then they turned diabetes management into a game. It empowered the child and reduced parental stress. So what parents must do, they must focus on empowerment, not fear. In Mumbai, one mother turned her daughter's story into a comic book that explained diabetes to friends. The result, more empathy and fewer questions. Then we have got how to manage emergencies and complications. Now, daily management is crucial, but we must also prepare for emergencies. Okay, here we have done this. Okay, please continue. So, children with juvenile diabetes are at a risk of both high and low blood sugar episodes. In fact, we had 2-3 people in our diabetics challenge class, they had all these problems. But then they found that with neurotherapy treatment, the high and low blood sugar episodes, the rapid fluctuations, sudden fluctuations, they were all under control. So I think I had put this thing in the group long ago. One lady had commented about it. Okay, so this high and low blood sugar episode can escalate quickly if not addressed. So what is hypoglycemia, low blood sugar? That is when sugar levels drop below 70 mg per dl. What are the reasons for this? One is missed meals. You know, in your hurry to get your college work, school work done, you miss a meal, or you suddenly do extra exercise which was not there earlier. So that will also cause hypoglycemia, or excess insulin due to some wrong dosage. So what are the symptoms? The symptoms include shaking, sweating, confusion, irritability, dizziness, fainting, or seizures in extreme cases. So shaking, sweating, confusion, these are all related to the brain. Even irritability and dizziness also related to the brain. And all those things can culminate in fainting or seizures in extreme cases. So, for example, in Surat, 11-year-old Dave, he forgot to eat his snack before a karate class. Halfway through the session, he began sweating and his words became slurred. You know, like a sharabi, a person who is high on drinks. You know how the words slur. So like that, halfway through the session, because karate class means a lot of energy is going out. So he started sweating and slurring. But because his coach was trained by Dave's parents, he quickly gave him a glucose gel and called his mother, and so Dave recovered quickly. So this is all this thing, effect of hypoglycemia. So what is the action plan? The parents and children have to train themselves. Always carry glucose tablets, candy, or juice. Then educate teachers and caregivers on how to respond. This is very essential. Parents of diabetic children should talk to as many people who are involved in the child's welfare, school, at the karate class, etc. Everywhere they should inform them, and all the people are ready to help if they know. So they have to be trained properly, and then they should use CGM device with alarm. So this was about hypoglycemia. Now we will come to hyperglycemia, high blood sugar. This occurs when levels rise above 180 to 200 ml. Okay, sorry, 180 to 200 mg per dl. This may be due to illness, stress, overeating, or missed insulin doses. So hyperglycemia, that is high blood sugar, which is what diabetes is basically about. When the level of sugar in this thing, in fasting or postprandial, it goes above 180 to 200. Of course, I mean postprandial sugar. goes 180 to 200, then it is called hyperglycemia. And this can happen either due to an illness or due to stress or overeating. Overeating also causes hyperglycemia because more sugar you are eating, and then missed insulin doses. So here, what are the symptoms? Here the symptoms are excessive thirst, frequent urination, fatigue, blurred vision, and nausea. And when you compare it with hypoglycemia, hypoglycemia is shaking, sweating, confusion, irritability, dizziness, and fainting. Whereas hyperglycemia, it is excessive thirst. But these are all like diabetes mellitus, DM type 2. Excessive thirst, frequent urination, fatigue, blurred vision, nausea, etc. Now, the difficulty is when hyperglycemia persists for a long time, it can lead to diabetic ketoacidosis. And that is, I told you, it is a life-threatening condition because the body starts breaking down fat for energy, producing ketones that make the blood acidic. For example, Zoya from Lucknow, she once forgot her insulin pen on a school trip. Her sugar levels kept climbing, and by evening, she was vomiting and breathing rapidly. And that breathing rapidly is called kismol breathing. Okay, so she is breathing very rapidly. Then her teacher recognized the emergency and rushed her to a hospital where she was treated for DKA. So the moral is never, never, never skip insulin. Monitor sugar during illness. Learn ketone testing and maintain a sick day protocol. Okay, so now we come to psychological and social impact. Okay, so juvenile diabetes doesn't just affect the body, it deeply affects the body, the mind, and emotions. It is not just a physical condition. Living with juvenile diabetes can take a toll emotionally, both for the child and for the family. So let us see what is the psychological impact for the child. Basically, this is actually a slight repetition. One is fear of injection or finger pricks. This is the fear for the child, which is of course mitigated to a less extent by use of CGM, continuous glucose monitoring. Okay. Then embarrassment about managing diabetes in public. I told you how one girl, she had this problem, and then the teacher gave her support by giving her a special space where she could have her insulin injections. But that is a problem for the child. Then isolation from peers. Yeah, because she or he is different because of this insulin injections. Then anxiety or depression is a very common outcome. And for parents, what are the issues? Constant worry, and they get sleep disruption because at night also they have to keep checking the sugar so that the child should not go into hypoglycemia. So sleep disruption is very common for the parents. And then guilt or blame. They always feel they are to blame, they are guilty, like that. So they feel that guilt is there. Then what are the emotional challenges? Because it's a teen year, that brings unique challenges. Fear of complications, depression and anxiety, feeling different from peers. These are all the teenage brings this. Always the fear will be there. What will happen? What will happen? Fear of complications. Then because of that depression and anxiety, feeling different from peers. Then sometimes, the child becomes so much, insensitive, let us say, that it starts taking risks. Risk-taking behavior persists. For example, skipping insulin, eating sweets. No, arey kya hoga, jaane do. I am suffering. Let me at least enjoy. No, that feeling comes. Okay. So, risk-taking behavior. Then body image issues with devices and pumps and CGMs. So you don't look good when you have all those things. So body image issues happen. So how to address it? What are the techniques to address these problems which the child is facing because of teen year? Unique challenges the child is facing. The number one, awareness sessions in schools. So the parents and the teachers, they should all sit together and then talk about awareness sessions in schools so that the children don't make fun of the child. Then parent-teacher meetings should be focused on the health needs. And then encourage normalcy. Never let the child feel different. So let the child participate in sports, cultural events, outings, etc. But all with proper precautions. The child should be encouraged. No, you go participate in sports. Don't feel you are less, like that. And many children excel, even in spite of the diabetic condition. So, for example, in Patna, girl is called Anushka. She was aged 13, teens. She refused to go to school because her classmates made fun of her insulin injection. But her parents worked with a school counselor and they organized a diabetes awareness talk. With peer understanding, Anushka returned to school confidently. Then a teenager in Hyderabad, she shared that she felt isolated until she joined an online support group with other diabetic teens. This made her feel less alone because she understood that there are many people like her. And so she became very positive. And a 14-year-old in Chandigarh began skipping insulin doses out of frustration. As I told you, children become out of frustration, they start risk-taking behavior. I told you. So risk-taking behavior happened. But then with counseling, he was given proper counseling, and with the help of a support group, he began journaling and managing better. So what are the support strategies we can suggest? Connect with other families through local diabetes support groups. Enroll children in diabetes camps, like the ones held annually in Jaipur and Hyderabad. In Jaipur and Hyderabad, they hold diabetes camps for children. Then seek help from pediatric psychologists. Then seek help from school counselors. And then diabetes educators and mental health professionals. So many people are there, support strategies. Then you also have diabetes support groups, like in Hyderabad and Pune, they have active parent-led communities. Then social workers and diabetes educators, they are also there. And finally, nowadays, online support through WhatsApp group and Zoom meetups. So this is something very good. So we have a good news that in Kerala, a school started a buddy system where classmates helped diabetic students to remember their snacks and check sugar levels. And a parent group in Coimbatore created a mentorship program where newly diagnosed families are paired with experienced ones. Then a 10-year-old boy in Nagpur who was diagnosed early is now excelling both in academics and in sports. His family accepted the diagnosis positively. So they didn't make fun, they didn't blame. Sometimes blaming is there. Either the parent blames each other or the parents blame the children. So those things were not there. The family accepted the diagnosis positively. And so he is now thriving with regular monitoring and support. Then in a school in Patna, a teacher penalized a diabetic child for snacking in class because the teacher didn't know about the condition. But after an awareness session, the school updated its health policy. So they said, no, such a child can snack because it's having diabetes. Similarly, in Mumbai, a peer monitoring group for teens with diabetes has helped to reduce depression and improve treatment compliance. Then teens relate better when they learn from others facing the same struggle. So now let us see modern tools and technologies. So technology is transforming diabetes management from painful finger pricks and insulin vials. Earlier we had finger pricks and insulin vial only. So from there we have now moved to smart devices, which we had told earlier. What are these insulin pumps? They deliver insulin continuously through a cannula placed under the skin. So they reduce the number of daily injections. They allow for more precise control. So Aditi from Kolkata, she switched to a pump at age 10. So now she plays basketball and even goes on school trips without worry. So the technology is continuous glucose monitor, CGM, insulin pumps, and then nowadays you have mobile apps for logging food and insulin doses. Now a Bengaluru-based startup has created an app that helps kids calculate insulin doses based on their meals and activity level. So by doing this, this has reduced human error and built confidence. So in Mumbai, a pilot study is being conducted using hybrid closed loop insulin pumps. And what do? They adjust insulin delivery based on real-time sugar levels. Then you have nowadays research is going on about artificial pancreas system, beta cell transplants, genetic therapies. Then CGM is there. We have already spoken. They provide a 24-hour glucose tracking. So new models are coming with smartphone integration and alarms for high and low. So that means they will ring an alarm, whether it is hyperglycemia or hypoglycemia. Both cases they will ring alarm. Then there are flash glucose monitors. That is a sensor worn on the skin that shows sugar levels when scanned with a reader. Then you have smart pens and apps which allow for better insulin dosing, and they track the carbohydrate intake. Then you also have online consultations to help families in rural areas stay connected with specialists in cities. So nowadays, some rural areas, they are having children, this juvenile diabetics. So this is online consultation will help them. Then you have got an organization called CDIC. It's a governmental this thing, changing diabetes in children. And then there is one JDF India. So they offer free insulin and education. And some state governments now include type 1 children in health schemes for chronic conditions. Okay. Now, that we have got, yes. Now, what a supportive ecosystem, how to create. Every child with diabetes needs a circle of support, that is family, friends, teachers, doctors, and society. So much support it requires. For families, this thing is learn everything you can about diabetes, especially diabetes type 1. And then stay calm during highs and lows. There is no point in panicking, because then the child will get panicked also. So stay calm. And I have given enough inputs here already. Involve the child in decisions and celebrate successes, no matter how small. Then that is for families. And for schools, schools should create a diabetes-friendly policy. They should allow flexible meal and snack breaks, and they should train staff to recognize and manage emergencies. For example, a school in Coimbatore, they invite parents of diabetic children to conduct annual awareness programs. This initiative improved empathy and encouraged other students to support their peers. So after families and schools, we come to communities. So communities should stop stigma and myths. We'll see what are the myths later. They should include diabetic children in sports and festivals, and they should support inclusive policies. Now, what are the myths? Myths number 1 is type 1 diabetes is not caused by eating sweets. I told you type 1 diabetes is this thing. It's an autoimmune disorder. Okay, so it is not caused by eating sweets. It is not contagious also. That means the children who are having a type 1 diabetic boy in their class, boy or girl in their class, can go and shake hands with them. They can play with them. They can make them feel normal. Okay, but one thing is it cannot be cured with home remedies alone. So that is, if anybody thinks that diabetes can be cured by home remedy alone, no, it is not so. So in rural areas of Madhya Pradesh, awareness programs have helped to reduce stigma. Families are now seeking medical help earlier. Oh, sorry. Okay, 1 minute. Then ICMR, Indian Council of Medical Research, it is collaborating on vaccine trials aimed at halting the autoimmune process. Okay. So what are the myths? Myths busted. Some things the people feel it happened because of too much sugar. Certainly not. It is not true. The juvenile diabetics will go away when they grow up. No, it is lifelong condition. And insulin is harmful. No, it is life-saving, in fact. Okay. So final story, Tarun, 16 from Udaipur, was diagnosed at the age of 8. Today, he is an award-winning swimmer and a youth ambassador for diabetes awareness. He says, diabetes is part of me, but it doesn't define me. So let us continue to spread awareness, offer support, and empower our children. Juvenile diabetes is manageable. With compassion, education, and unity, we can ensure every child lives a full, vibrant life. Okay, so now I'll come to the end of my lecture. I just want to leave you with one thought. Children with juvenile diabetes can lead a full, active, and joyful life with the right support, knowledge, and empathy. They are resilient and capable. With the right tools, support, and awareness, such children can thrive in every area of life. It is up to us as a community, as educators, as healthcare professionals to ensure that they are not held back by stigma or misinformation. Okay, so with this, I will now take up any questions if there are. Of course, this is a pretty okay, pretty long session. It was theory. Okay. Now
Requesting
we
you
can
all
see.
to raise your hands for your queries, please. And
Yeah,
switch.
1 minute. I have to first. Please give me 1 minute time. Okay, fine. Okay, now as I said, I'll be soon announcing the diabetics challenge group again, and few people have written. We'll see. We'll announce it, and then all of us can have a lot of interaction through it. Okay, so I don't think there are any questions. Nobody has raised their hand. Let us see. We'll give some time. And now we don't have to have questions only on juvenile diabetics. We can have general questions. If you have anything for yourself, for your parents, I mean, for your patients, definitely you can ask that question. We have got some time now. It's another 20 minutes we can spare for that, in case any of you want to ask questions, or any of you have attended my earlier classes and you want to have repetition of some points, you can do that. And otherwise, we can also call it a day. Yeah, Nadiraji, yes. Yes, madam.
Good evening, sir.
Yes,
Sir,
good evening.
did you, is there any case by using narrow therapy treatment, this type of diabetes is cured?
1 minute. I am not able to completely hear you, but let me see. Yes, please once again repeat your question.
Can this type of diabetes, one type can be cured by neurotherapy?
I will not say we will cure it, because curing means being totally free from medicines.
Yes.
Okay.
Yes, sir.
But we can help. See, now what is happening, all of you understand this. The word cure means being free from medicines and being free from symptoms. Now, what is happening is, with medicines, still many of the symptoms which a child is facing, child or adult, whoever the patient is facing, many of the symptoms are not able to be tackled. The only thing medicine is able to do is make that the sugar under control. Okay, but so many side effects and so many other things which are there, those are all tackled by neurotherapy. For example, a child becomes anxious and depressed. Now, depression, they will only give you another tablet which will spoil the liver or which will spoil something else, and then they will give you some other tablet for overcoming that. But in neurotherapy, if the child is not having sleep, I have got serotonin formula to give it sleep. I can have another similar formula for reducing it out of depression, coming out of depression. I have got treatments for improving their hunger, so that they don't eat unnecessarily. The sugar craving is not there. So like that, neurotherapy can help a lot, very lot, in improving the quality of life of children and parents and caregivers. So that's a very big thing. So that is almost like a cure, because if in the other way, in the medicines alone, you are only, if the child doesn't respond, either you increase the dose or you decrease the dose. That's all. But all those symptoms, for example, there are many symptoms which I have not covered, but I have given you already some 8 or 9 symptoms today. They are the main symptoms. In that also, we have got neurotherapy and other techniques where those symptoms can be tackled by neurotherapy without harming the child, and in fact giving better results, positive.
Okay, sir. Thank you, sir, for
Welcome.
introducing this neurotherapy to all of us, because it is giving very good result. I am getting very good result along with the other therapies. I am using your neurotherapy. It's giving very good result.
Wonderful, wonderful.
Thank you, sir. Thank you very much.
1 minute, Nadira ji,
Okay.
I have got one request from you. See,
Okay.
if you are going to use neurotherapy for other people, you do consult me whenever you have time, and if I have time. I am also quite busy, because you see, sometimes I have taught in these classes, I have taught very limited repertoire. I have
Yes,
a
sir. Yes,
repertoire
sir.
which is so much, I have a repertoire which is so much, and I want to give it all to everybody. So and that can be done very much only when the patient is in your presence. And nowadays, Zoom means I am right in your bedroom. I mean, I am right in the patient's bedroom, because in Zoom, I am everywhere available. So that will help. And another thing is, do not mix neurotherapy on the same day with acupressure or acupuncture, or any other. I mean, even
I
don't.
have gone through the books, neurotherapy book. I have read that book fully, so I got very
No.
good
I am not.
knowledge.
I am very happy. I am very
Yes,
happy
sir.
that you are doing it. But what I mean to say is, I may have more.
Yes, sir. I will gain your experience from your experience, because why I am using means I go through the neurotherapy book, full book. I have gone through it and repeatedly revising it again to understand that all the points, because as you told, there is so many points are there. So only I also told in the group, we have to know each and every point. In any therapy, you have to know what the color is doing, what each color is doing, points are doing. Likewise, in neurotherapy, how it is working, because there is a pressing times are different for different chemical secretion. No, so
Yes,
it's
yes, yes.
very nice. Because I go through the book, so it's very useful. Thank you, sir, for introducing
Okay.
neurotherapy. It's giving
Okay.
good result. Immediate
Yes.
result. I am feeling.
Mm.
But people are getting wanting only that 1 point therapy. I am telling them to follow this, but they are not aware of it.
No, no, no. See, any
Mm.
new see, I have been very late. Joshi sir gave me this chance from COVID time itself. He
Yes,
gave
yes,
me the
sir.
chance.
From first time also, I am from first time onwards. I also talk to you. I am from Tamil Nadu, no, Pondicherry
Oh,
only.
yeah, yeah, yeah. Yeah, yeah. Now I remember Nadira from Pondicherry.
Yes,
Yes,
sir.
yes, yes, yes. No, no. The thing is that I was a bit slack for 2 years because of so many reasons. I could not have my classes. Now I have actually for another group I have started English classes already. In case anybody is interested,
When
they
I
can.
call you, when will you be free, sir?
Ah, uh, normally around 12 or 12 between 12 to 1 in the afternoon, I am free.
Okay, sir. Okay, sir. I
Anybody
welcome.
anybody
Mm.
wants, they can. But you have to fix up in advance because
Okay, sir.
sometimes I,
Mm.
yeah, you give me 1 day,
Mm.
1 or 2 days advance notice, then anybody can
Okay, sir.
consult it.
Okay.
Okay.
Thank you,
Okay.
sir. Thank you very
So
much.
nice. So nice. Yes, Sister Mercy, please let me know.
Good evening, sir.
Good evening. How are you?
I'm fine, sir.
Yeah,
Are you able to hear, sir?
yeah. I am able to hear.
Sir, one of my relations is conceived. This is
Hmm.
the first semester,
Hmm.
and she was continuously vomiting. That's why I asked you. Then you told to do, but then you gave some of the example also. Then I told her to do that CNS gas plus
Yes.
liver.
Yeah.
This both exercise I told her and I taught her in video clips.
Hmm.
Then she was doing.
Hmm.
Before doing that, she was vomiting and blood also was coming in that
Hmm.
vomiting.
Hmm.
After doing this, the
Hmm.
blood stopped, but
Hmm.
the time, the frequent of vomiting is decreased, but still she is vomiting. So I
Hmm.
told her to continue the exercises.
Ah.
The treatment
So,
wise for her, for us it is treatment, for them it is exercise.
no, no, I will give you one more. Please
Okay,
understand.
sir.
There is one more.
Mm.
All
Mm.
of you know 60-toe finger gall liver, right? 60-toe finger gall
60.
liver. Yeah.
Mm.
This, this tip of
62.
no, no, no. Toe finger gall liver I have shown on the third left leg, third toe or fourth toe. I have put the video in the group so many times.
Yeah, that is
Yeah, it is
liver,
called.
one liver.
No. Apart from liver is there. Liver, of
Mm.
course, what she is
Mm.
doing is okay. Now, another, I am adding one more. That is called
Okay, sir.
60 toe finger gall liver. Okay.
62 gall
Liver.
liver.
I'll show you here. Simple. You see, like this.
Mm.
This one on the third toe and fourth toe.
Okay, sir.
Okay, this she can do many times. Now ask her
Mm.
for ladies, you ask her to add first left leg, third toe and fourth toe. After that, add both little toes. That means
First left leg,
third
third,
toe,
second, third, and fourth.
third and fourth. Then
Then
both
both
toes together like this.
small toes.
Yes, both small toes. You can see I am doing like this.
And that is into 60 times, no, sir?
Yeah. Now for her, tell her to do 20 times, but 4 to 5 times a day. Instead of 60, 60 was for injury.
Ah,
Okay. 60 was for injury. Now she doesn't have any injury. So
okay.
what she will do,
No.
she will do 20 toe finger on third toe, 20 toe finger on fourth toe, then both toes together. Like this. Did you get it?
But fourth and fifth only in left leg, no, sir?
Third and fourth in left leg, fifth in
Both
both legs.
small, both the legs.
Yes.
This is called 60-toe gall liver.
Gall liver WD. No, now I am adding. Gall liver is only here, only left leg. Now I am adding 60 toe finger gall liver WD.
WD.
Ah.
This
So
also
this,
for vomiting, na sir?
no, not only for vomiting, for everything. It is for for strengthening the muscles around the uterus.
Okay, okay.
So that is what she requests. And probably,
Strengthening the uterus muscles.
yeah, strengthening the uterus muscles.
Sir, one more thing, sir.
Yeah.
75-year-old lady, she checked her sugar level. It was below 200, like that. She is 75 years lady. And later on, she was taking tablet with thyroid tablet. And thyroid also become normal and sugar also become normal. But now she's having frequent dry cough. When she coughs, she goes and wets the bed, everything as a urine.
Yeah. That is because the perineal muscles, that the perineum over here, those muscles are weak. This I have already told earlier in another context. What I say, lie on your abdomen, lie on your stomach, and hit with your heels on your buttocks. So
on the back.
On the back, yes. That is one. And she also can do this 60 toe finger gall liver WD. That she can do before the exercise. The same treatment. She can do this, and then she can do the banging the heel on the buttocks.
That is, she can lie down in the floor, no, sir?
Yeah, floor or bed, whatever. Bed is enough.
Whatever. Lie on the bed, lie on the abdomen.
Yeah, lie on the abdomen, prone position.
And heel has to touch buttocks.
If possible, even if it does not touch in the initial stage, it will not touch. But doesn't matter. Let her go on doing alternatively. First alternatively, then together. And if she can take the help of somebody, if they are possible, they can slightly press her heel down. If it is not touching. If it is touching, then very good. Won't touch for her.
But if she can't touch, somebody has to help her.
If take help, very good. Otherwise, also after about 15-20 days, the muscles will become looser. It will become all right.
Okay.
If somebody helps, it's very good.
This is called what's up? But touching the heel, touching the buttocks.
I haven't got.
This is called.
I have not.
Okay. So she has to do 62 gall liver WD plus this heel touching.
Yes. Instead of 60, as I said, see, 60 is for when you are doing only once or twice a day. If she can do many more times a day, even 20 is enough.
Okay, sir. 20 times. Often she sits in the bed or she walks under. No. When she sits and relax, she can do it.
Yes. Anytime.
Okay, sir. So she also has to do on left side.
Left and both toes.
Both small toes.
Yes.
Thank you so much, sir. Sir, one more thing, sir. No diabetes, no sweating, no frequent urination, nothing, no symptoms of diabetes. But she's having continuous genital area itching. And she can't take out the hand from there. Always wants to do something cracking like that area, sir.
I agree.
Front and back both. Yeah, front and back both.
Yes, yes,
and
yes.
she is crying like anything. But in front of others, how can I touch there? So
Yeah,
like
yeah,
that
yeah.
and all.
No, no, no. She doesn't require to touch.
During during the sleep also.
Yeah, yeah, I agree. Don't worry. This is all
Uh,
pitta. This is all pitta, pitta, pitta.
Acha.
So for that, the best treatment is now not all toes, only third toe, only third toe.
Oh, both the legs, sir, or
No, no,
left?
no, no, no. Only third toe, left leg,
Only third toe left.
left leg. Let her do only six times. Six. That's all.
6 times.
Yeah, 6 times this side and 6 times this side. Inside, like this.
Hmm.
See, one is 6 like this. See, one is 6 like
Hmm.
this, and another is 6 like this.
Okay, sir.
This can be done every 2 hours. And after 3 or 4 days, if still she does not get complete results, then she should do 2 pan into 6. 2 pan.
2 pan into 6.
Yeah.
Hmm.
I have taught this 2 pan
Okay.
earlier. I'm sure you know
Yes,
it.
sir.
Yeah.
Yes, sir.
So these 2 things will be
So,
enough.
and after doing this, then I will, I will lift my hand to share about this.
Yeah. Please. And also you should share here. Yes.
Yes, sir. Thank you so much, sir.
Oh, my pleasure. God bless you.
Thank you.
Welcome. God bless you. Nadiraji, you still have something to ask? You can ask.
Sir, when to use both? We are doing gal and liver protocol, sir. When to use this TF toe, finger toe, gallbladder and liver? Because you are saying you are saying to do gallbladder and liver, and then TF also. For severe cases, you have to do, sir.
No.
Mm.
TF should be first, then only here.
Okay, sir.
First TF, then TF is the remote control. First activate the remote control, then go to the direct organ.
Okay, sir. Thank you, sir.
Welcome.
What for in now in this also you told for this person 6, another person you told 60 or 20 like that. What is the difference in that, sir?
No,
Six and
see, the difference means the amount of stimulation. It is like drip irrigation. In drip irrigation, what we are doing, we are giving one drop throughout the day or something like that. So then what are the other type of irrigation? You take one bucket of water and pour it, or one mug of water and pour it, isn't it? That is one method of irrigation.
yes.
Another method is drip irrigation.
Yes.
Drip irrigation, we are not having one bucket of water, we are having one drop of water. Got it? Like that, when you are doing only once or twice a day, or in case of a serious injury where, for example, that 60-toe finger gall liver, that is often used for injury, for big pain. So when that is there, then because there is a lot of pain, I want to reduce it. So I give more number of this thing, twists or whatever, more number of stimulation. And then after about 2-3 days, that pain will go. I don't have to stimulate also. Okay. Or I will stimulate once a day, etc. But in this case, this itching is a system is not getting proper stimulation. It is a long-term program. I mean, long-term problem. So for long-term problem, what you do, you have to attack it. You have to give it drip irrigation several times a day. That is why 6-toe finger. 6-toe finger and 60-toe finger will more or less do the same work. But 60-toe finger is a strong treatment which is required for acute cases, let us say. But this is a chronic case, this lady. So there I said, for example, even pregnancy, during pregnancy, if you give mild, because the skin is very soft there, that is the time because of estrogen, this thing, the skin will be very soft. If you do 60 times, the lady will do after 2 days, she will have problem here. She will have pain over here, or the skin may become rashes. So for that I said only give 6-toe finger, but give it many times a day. Do you get the picture? Yeah, Nadiraji. Nadiraji is not there. Nadira, you are here. So did you understand the answer? Anusha madam, am I audible or?
Yes, sir, you are audible, sir.
Okay.
Thank you, sir. Very clear explanation. Thank you very much, sir.
Yeah, I expect something shortly you must give. What is this? I say.
Yes, sir. I am now only she animated me, sir. Thank you
Okay.
very much.
No
Very
problem.
clear explanation, because with examples you are explaining, so we don't forget anything. Thank you,
Yeah.
sir. Another doubt one, for pan CNS, you are using that 3 sides, no?
Yeah.
For pan we have to use 3 sides only, sir, or we can do TF like that for pan.
No, which disease and all that you have to tell me,
Okay, sir.
or which condition?
Generally, I am asking.
No. In neurotherapy, it is like that generally.
Because most of time for a gal and a liver, you are using TF. For a pan, mostly you are using CNS. So
Not
I
CNS. Not CNS. You mean I am
that
using
one,
here?
yes, sir. Main thing that we are doing in brain area, in fingers, I am asking.
In finger for pan. That is in CNS. That is one.
No, sorry, sir. First, gal liver for pan. Yes, sir, both.
Pardon?
Yeah, for a pan and gas only. Yeah, gas.
Pan and gas only. Yes, we are using all 3 sides because they are giving. The pancreas has got many more functions, and even this Vajranadi, when it is stimulated in all 3 sides, it works differently. If you cannot do all 3 sides, then at least do one center side.
Okay, sir.
But otherwise, you can all 3 sides gives better results.
Okay, sir. Okay.
Okay.
Thank you, sir. Thank you very much.
Welcome. Okay. Anusha madam, I think it is now time we can call it a day, because I don't see any other hand. So you can wrap up all this thing. And I thank all the 40 people who are here. I thank all of you for staying on till the session is over. And after this, of course, Anusha madam will tell you to go and write in the group. So all that she will tell you. Okay.
Thank you everyone for participating in this session, first of all. And secondly, I want all of you to go back to the group and share your feedback, and at Ramachandran sir or at Neurotherapy, so that everyone will know what is happening in the class, what we covered today, how sir is explaining, what has he explained, everything you can write in detail. No worries. At least everyone will get a synopsis of what sir has taught today. That will be helpful for them to decide and join these classes very frequently. Okay, because they should know what they are missing also. So let them know with your feedbacks, and with all your gratitude. I am sending our gratitude all together from Joshys Kerala group to Ramachandran sir today for this wonderful session on juvenile diabetes. And I guess there is one more session, sir, or is this the end of it?
No, I think I have finished. We
Okay.
don't require one session now. So
Okay.
I don't have matter for one full session. Then that will be only small talk on insulin that we can add later on at any other time.
Yes,
Okay?
sir.
I will
And
see.
we have any future paid classes for diabetes, sir, now?
Yeah. The next, this is now month of this thing.
April.
You announce it. You announce it that let people start asking, joining. Let us keep. We'll start it from say 1st of June, because we will require at least 2-3 weeks now for people to make up
Yes.
their mind.
Yeah.
So you can announce it in the group that those who like you did last time, you do it the same way. You can announce it.
Yes, sir.
Okay.
So please note, we have a paid session soon. So in June 1st week. So all of you get prepared for this paid session, and all the details will be shared in the group soon for the paid session. Okay. And till then, now I'll pass the mic to Ramchandran sir to finish his blessings so that we can end this session peacefully.
So thanks to Joshys Kerala group, thanks to Joshi sir, thanks to Anusha madam and the other team members. I hereby pay my gratitude to the whole group and who are attended today. And may God bless each and every one of us and our families and friends with health, happiness, harmony, peace, prosperity, and success. May all of us and our families and our friends' families be blessed with health, happiness, harmony, peace, prosperity, and success. Thank you very much. Good night.
Good night, everyone. And as I already sent gratitude from all of you, but it doesn't end here. You have to go back to the group and share your feedbacks and gratitudes in the group, and also with the synopsis of the session, please. Till next weekend, we'll again tomorrow and day after tomorrow, there are no classes. Monday class, we have it at 8:30 p.m. So please attend the Sujok class. And till then, happy weekend to all of you. Have a safe time enjoying with your family. Thank you, sir, from all of us. Good night. And thank you for choosing all difficult subjects for people to understand, especially understanding the physiology of the particular disease is very important. Where it's where it's coming from, how it's showing us with its symptoms and all these things. And the treatment is also very important. Other than the other things, we have to change in our lifestyle, food, and everything. So I request all of you to follow everything when you're treating your patients, or when you're treating your family, when you're treating your friends. Please also make sure that you're counseling them on what are the best ways to heal them faster, not only treatments, because their personal, emotional well-being, everything is very important. Ask them to stay positive on everything so that there will be positive results and faster results also, because juvenile diabetes is not a small issue, and many people suffer even in their elder ages also. Some people don't know they have that and they keep suffering, and some people don't like to go to hospitals. Such people also keep suffering, and you as healers can personally help them with learning multiple therapies, and find out which therapy is working very well for those patients. And neurotherapy, I am very sure it will be working on for all other symptoms that might be carrying from so many years. So it can give a big reason for you to choose neurotherapy and work it out on your patients, friends, and family. So keep joining in regularly till next class. Wishing you all a happy times. Thank you so much for joining for this session from Joshys Kerala Group. Good night, sir. Thank you so much. Gratitude, sir, from all of us. Bye, everyone. Ending the session.